All right. Well, maybe more folks will join us as we keep going, but we'll go ahead and get started. Welcome, everybody, and thank you so much for joining us for Breaking Bread. Um, as always, well, not as always, but as recent, we're having a virtual potluck today. We usually gather together over food, but today we're virtual, so I hope that you brought your lunch. I'm having soup today, butternut squash soup, so I'll enjoy that as we go along, and feel free to have your lunch with us. Just a reminder that we are recording today so that we can share this with everyone who wasn't able to make it, and we hope that won't inhibit conversation because we want to generate a good flow of ideas and solutions. So some of you know that we've been having Breaking Bread gatherings for 3 years or so. This is our third time doing it by Zoom, and it allows us to stay together during times when we can't gather in the same space, but also allows more people to join who might not usually be able to get to our space at that time. So we're happy to have this opportunity to gather. We break bread together because we understand the power of food in each of our lives and the power of food to bring us together across lines of difference. And the premise behind breaking bread is that solutions begin with conversations. So we're seeking new strategies to end food insecurity in our community that go beyond the important food assistance that we provide every day at Manna. Food assistance is important, but we know that it's not the whole solution. So we ask through Breaking Bread what we can do as individuals or in small groups of people to address the root causes of food insecurity. So before we get into the serious information, serious discussion of today, we always start by introducing ourselves so we get to know who we're sharing the space with. We do it a little bit differently when we have a large group. But what we do is we start with something called new and good. And we ask everybody to share something that's both new and good in your lives. I'll ask that you type it in the chat, and then we'll call on some folks to share out loud, but we may not be able to do that with everyone in the time that we have available. And I'll just start so that I can give you an idea of new and good. The most recent new and good I shared with the Manna staff had to do with ice cream, with a key lime flavored ice cream, which was very exciting. But I have something even more exciting today. Tomorrow I am leaving to go to Chicago to visit my mother, and I have not seen my mom in person since the beginning of the year. So looking forward to seeing her beautiful face in person. So that'll be new and good for me since it hasn't happened for quite a while. So I want to encourage some other folks to share with us something that's new and good. And if it just has to be new or good, that's fine too. I don't see anything in the chat yet, so I'm going to encourage you to go ahead and type something in the chat, or just raise your hand even if that works. Okay, so we're starting to get a couple of folks. That's great. I'm going to ask everybody to keep posting in the chat. So we'll start with Priya. Priya, do you want to share your new and good?
Sure. So I just put in the chat that the cooler weather that we've been getting, and I believe we'll continue getting for this week, is new and good for me. I've always really liked this crisp fall air as opposed to any humidity. So that's my new and good.
Thanks, Priya.
Mhm.
And Lauren, you shared, what would you be willing to share this out loud for us?
Yeah, sure. So for me, I've been journaling a lot more with being back home now since COVID. I finished my master's in May from home, and it was like an abrupt moving back home with my parents. So just having that time to reflect with everything going on has been really helpful.
That's great. Thank you. Congratulations. That's wonderful. I realized I forgot to introduce myself. So I'm Angela Whitmall. I am the Senior Director of Participant Support for Manna Food Center and the usual host for Breaking Bread. Jackie has exciting new and good. You're muted, Jackie.
So our sometime Breaking Bread person and master gardener, Robin Rittenhoff, gave me some pepper plants at the beginning of the COVID shutdown. And these are especially nice for me because they are sweet peppers. They are not hot peppers. They're Nardellos. So new and good.
Thanks, Jackie. Sil, can you share your new and good?
Oh yeah, absolutely. So we typically only do spring mulching, but this year we wanted to be a little bit more aggressive and just make sure that things were growing properly and weeds weren't getting out of control, and the beautiful plants that we did plant last year and earlier in the year will remain, like especially the perennials. So we did some mulching and got that completed last weekend. So super excited about that. It was nice and cool, and yeah, it was good. It's a good start to welcoming the fall.
Great, thank you. It looks like Cynthia has exciting news.
Yeah, so long story short, so my master's degree is in nutrition and integrative health, but I can't practice nutrition until I get my license. So you have to do hours, and then I also had to take an exam. So I took my exam at the beginning of August and I passed my exam. So now I'm a licensed nutritionist in the state of Maryland. So
Woohoo! Congratulations.
Thank you.
That's good news. All right, and Cheryl, can you share your new and good?
Hi, sorry I'm on mute, but usually my Teams and Zoom goes off because of my terrible internet connection in my building. But at any rate, yeah, I've just had a lot of fun. I decided to find out more about my ancestry. And so when I did my DNA test through 23andMe, I have 1,500 third cousins all over the world. So it's really fun.
And you've talked to them all already, right?
Oh yeah, absolutely.
That's great. Yes. Thank you. And Marcus, hi, welcome. Can you share your new and good with us?
Hello there. Greetings to everyone. Yeah, so exactly a week ago, I accepted an offer to be the hub coordinator for Kingdom Fellowship CDC. So it is very new. And yeah, and it is very good. So, yeah.
Great. Well, we look forward to working with you.
Likewise. Thank you.
All right. Izat, what's your new and good?
Hi, everybody. My new and good is that I'm actually getting some time off in October, but I'm really looking forward to it because since the pandemic started, I have not had a day off except Labor Day.
Yeah, that's great. Will you be staying home or heading away?
I haven't decided yet because my husband is supposed to be coming down. He's been out of the country, so he's kind of stranded. So I'm hoping that he will be coming in that time frame and we'll do something together. I'm keeping my feet.
Nice. Yeah, that sounds great. All right, well, we have a little bit more time. Is there anybody who hasn't shared something new and good who would be willing to do so now? Elizabeth, how about you?
I am happy to say that I am planning to hike in Bryce and Zion next week with a group out of Parker Palmer's Center for Courage and Renewal. It's my first time doing anything with that particular group, so I'm excited both about going to a new place that I know to be beautiful from friends' reports. And I know I will have a fabulous time, and I'm looking forward to connecting with people from the group outside of Philadelphia as well.
Nice. That sounds wonderful. You got a thumbs up from Sil, who is our hiker on the staff. She's not the only one. I see Jamal there too. And still sending you a recommendation. All right. Anybody else? New and good, or if you just want to say hello.
I'll say hello. Good morning, everyone, or good day. I'm Reverend Rebecca. I serve UU congregation in Rockville, Maryland. Let's see, my new and good is I had a great workout this morning, and that just brings me such joy. Thanks for letting me share.
That's nice. Thank you so much for sharing. All right. Last call.
My name is Barry Carrie Fonge, and I am a guest invited by Miss Cynthia Wilson. I'm happy to be here today. Like Reverend Savage, I had a chair yoga workout today. That's one of the newest thing I'm doing this month, September, doing chair yoga every Wednesdays.
That sounds great. Thank you for sharing. It's good to have you here. And I think, let's see, that might, now there are a couple other people. I was going to say that might just leave Jamal, who I would have to put on the spot. So, you're muted, Jamal. You're on mute.
Yes. Hello, everyone. I'm Jamal Ray, warehouse manager at Manna Food Center. New and good. I'm part of breaking bread this afternoon, not running around the warehouse. So that's doing good.
Thanks for taking a little time to join us.
No worries.
All right. And there are a couple of other people. So if you haven't jumped in and would like to share something or say hello, please feel free to do so.
Hi, I'm Wynn. I am going to Baltimore this weekend, which I usually don't go to. I haven't been to Baltimore in a while. So I'm really looking forward to that, kind of exploring a new part of Maryland. If anyone has any suggestions or recommendations for things to do, I would love to know them.
Thanks, Wynn. All right, so all the hikers, check the chat because there are recommendations and questions. So we want to make sure everybody gets all the information that they need, and it'll be helpful to all the rest of us too. All right, well, we'll go ahead and get started. Thanks for everybody who shared and said hello. It's always nice for us to just get a sense of who we're sharing the space with, and that helps when we start having discussion. So I really appreciate that. Today, we have a really great program, and I am going to introduce my colleague, Cynthia Wilson. She's Manna's Community Food Education Program Manager, and she has organized our program and discussion for today. So I will pass the mic over to Cynthia, and she can let you know what we're talking about today and introduce our guest speaker. Thanks, Cynthia.
Yeah, thank you.
Before you get started, I'm sorry. I'm just going to ask everybody to mute if you haven't right now until we get ready for discussion. Thank you.
So I'm really excited about today's topic. The topic generally is COVID and food security and the impact on the African-American community of Montgomery County. So we have a wonderful speaker today, and I'm really excited to introduce him. It's Dr. Nkossi Dambita, And Dr. Nkossi Dambita has been the clinical director of the African American Health Program in Montgomery County, or AAHP, for over 4 years. He came to AAHP with 30 years of experience in the practice of public health. He received his trainings from SUNY, Buffalo, Tulane, and Johns Hopkins University. He has directed multiple public health programs at the local and state levels, as well as internationally. Some of the major public health projects that he's successfully managed include the surveillance of HIV in Maryland in the 1990s and the monitoring of bioterrorism in Baltimore City in the early 2000s. He is also on the faculty of Johns Hopkins University School of Medicine, and he provides advisory services to government and non-government organizations. He's really passionate about his current mission of eliminating health disparities in the Black population of Montgomery County. And under his leadership, AAHP's signature program called Starting More Infants Living Equally Healthy, or SMILE, was recognized as the best public health project in Maryland in 2018 by the Maryland Public Health Association. So this is going to be a great topic. I'm really excited to hear from him. I'm going to pass it over to Dr. Nkossi.
Oh, thank you so very much, Cynthia, for this wonderful and generous introduction. And I should congratulate you on finishing up your master's. I know that definitely we're going to grab you now to be part of our teaching staff for the chronic disease management. Because as you all know, and I'm really honored to be with you today. And again, it gives me great pleasure to talk about my passion, the work I'm doing for the African American Health Program. And you wanted to know a good thing that happened to me today. I see an old friend whom I haven't spoken with for a long, long time. And thanks to this invitation, I get to see Mrs. Bernice Mays. Hi to you, and thank you. To me, this is a real joy. I will put together a PowerPoint presentation, but I'm known to just use the PowerPoint presentation as an illustration. I prefer talking and discussing. And this is an important topic we're dealing with. Food is medicine. Food is life, and we live to eat. And that's so critical. And that would be the overall theme for today. Let me see if I can share my screen with you right now so we can go rather quickly through this PowerPoint presentation, and we can then have some time for discussion. All right. Can you all see my screen? Good.
Yes, we can see your screen.
Thank you. Hey, Mr. McFarland, great to have you on the meeting. Okay, let me start from the beginning. There we are. Now, what I'm going to try to talk to you about, of course, if you're talking about the African American Health Program, you have to talk about disparity in Montgomery County. And I will give you an overview of what we do at the African American Health Program, and then highlight some of the impact that COVID has had on our population. So let's get started. I don't have to preach you about what we live as Black people all across the nation. And the fact that we are going and the nation has awakened and pushing for social justice, there is a good reason for that. There has been disparity. Disparity, it's not always a relative term. I should say that, because if it were, we wouldn't be talking about any problem we've Montgomery County, a very wealthy county, a very healthy county. But that's, if you look at it in the general terms, that's what you get. But if you look a little bit deeper, if you dive a little bit deeper, what do you see? You see that there are some pockets where we can do better than that. Let's look at unemployment. And those figures are pre-COVID-19. And you can bet they have gotten worse. Unemployment, there is a ratio of over 2 for unemployment, 10% in the Black population as opposed to 4.5 in the white population. You look at family in poverty, and that's even a bigger disparity, 8.8 versus 1.8. It goes, you look at percent of families with children under 18 years old. Again, a big gap there. People who are unable to see, to use and go see a primary care physician. The ratio is 18% in the Black population, as opposed to 3.5 in the white population. Even with ACA, we do have quite a bit of people who do not have insurance in Montgomery County. And in the Black population, that's 13.1%. And we don't have to go far also from those statistics to assume, to know, to conclude that in the health area also, you will find some very shocking disparities. And we describe health disparity is refer to a higher burden of illness, injury, disability, or death experience in one group relative to another. And that's what we have. Again, if you look at the top, we can't go through all of these. You can come up with any indicators, you'll find out there is a great disparities. But at the top of the list, you have things I've already mentioned: an ability to have to see a primary care doctor. I've mentioned the fact of poverty. Mentioned visits to. I have not mentioned, but know that visit to emergency departments. There is a great disparity, 4.6%. Infant mortality. And infant mortality, we have to focus on it a little bit because that gave rise to the signature program of the African American Health Program, which is called SMILE. Although we have oral health as a focus area, but SMILE is not about dental care at all. SMILE stands for Starting More Infant Living Equally Healthy. And the SMILE program addresses the big disparity in terms of pregnancy outcome in the Black population. And we've almost 4-to-1 ratio between the white population in Montgomery County and the Black population. Although if you look at the, again, I mentioned earlier, if you look at just the overall infant mortality rate for Montgomery County, we're doing pretty good compared to other counties. But again, you got to dive deeper to see what all these general statistics are hiding. Mentioned food is medicine. If you take it inappropriately, there are some consequences. We eat poorly in the Black community. So it's no surprise that we are at a greater risk of obesity and with all the problems that you can think of, including being an underlying condition for COVID-19. I've already talked about the infant health, the disparity, whether you look at, we mentioned infant mortality, but you also have a percent of low birth weight. You have fetal death. You have maternal death. All these we are doing far worse than the rest of the population. ER visit, I mentioned that earlier. Why I'm putting the incidence of HIV, AIDS, and stuff, that's important. And believe it or not, thanks to the collaboration we have with Manna Food, we are using food that you provided to us as an incentive to get people to come and be screened. There is no reason nowadays for the transmission of HIV in our population, but yes, there is. And if anything we can do to lessen the impact of those totally issues, health problems that are solvable, and keep our effort and energy on the bigger picture, something like COVID-19 is important. So I've given you the background why there is a need for a program like the African American Health Program. Vision is simple. Getting the African Americans, people of African descent in Montgomery County, to make them as healthy and safe as the rest of the population. And in order to do that, the mission was set to eliminate all those health disparities that I mentioned, just some of them, to improve the number and the quality of years of life for the African American people. So having said that, let's look at some of the areas. You're familiar with those areas because you're getting quite a bit of traction in those areas. I call them the usual suspects. Area code 20886, 20912, area of Rockville with 20850 to 20853, Germantown, of course, 20874 and 20876, Gettysburg, the neighbor to Germantown, also, and then Silver Spring. And keep this picture in mind. I'm going to show you another one that you're familiar with on the right. It's a study that Johns Hopkins did years ago, and that shows food stores and medium income in Montgomery County. The light area, that means those are living the light life. It's good. Life is good. Life is light. The darker area is where, as set by the county, the people, the household living below $73,000 a year. And if you look at those areas, those are where you find food deserts. And you would think that that would be the opposite. Instead, you have a lot of convenience stores, little shops that are selling food of poor nutritional value. And that's what is fueling obesity in the Black population. So I'm not going to try to be a social engineer here and try to, a policymaker, but just making the observation. You see where the greatest area of disparity in terms of health is on the left side. And you also see that at the economic level, those are the areas that we should have access to good food. We should have grocery stores that serve us. Our service, what do you need to do to qualify for our service? Simple. You need to be African American. You have to be Caribbean. You have to be African resident and reside in Montgomery County. There is no income requirement. There is no citizenship requirement. And what are the focus areas? Maternal and child health is a big area for us. I already mentioned the SMILE program. And what really was a signature program was that what made it unique is the fact that we, in this era of detached, what I call detached medicine, we kept that warm touch. Our nurses go out to expectant mothers' homes to work with them and to help them go through pregnancy to ensure the favorable outcome for that pregnancy, and thereby reducing some of the great disparities that we talk about. Second focus, closely linked to nutrition, closely linked to food, is diabetes and heart health. And we used to give classes all across the county, in White Oak, in Germantown, Plum Guard, and to get people to incorporate in that prevention program, in that management of very, very serious illnesses such as diabetes and heart, cardiovascular diseases, incorporate a lifestyle that would lessen the impact of those illnesses. So eating is even very important. And it's so important that we have a Food for Life instructor that is part of the team that is tackling diabetes, cardiovascular diseases, other chronic diseases, cancer, and what have you. Because, believe it or not, even the type of food that you eat has an effect on people in early Alzheimer's and what have you. So food is important. Food is part of what we do. And I can't go because time is limited. Today, I cannot. I would like to talk to you about all the things that we do, but let's just focus on the food part of it. We have collaborated with Manna Food prior to the COVID-19. And we essentially been getting food for the various program. And we've had our chronic disease management class participants to go and interact and see what Manna Food is doing. Walk them as if through the aisles and the food label reading and all these good things that you're teaching people how to do. Actually ask them, we went on the field trip. Both, we asked our class participants, those from Germantown, those from White Oak, to come to us. We went to your office in Silver Spring to show them how to seek healthy food. So that collaboration was stopped by COVID. So I'm coming to COVID now. COVID came with his whole list of problems. Tremendous stress, people losing job. And if you lose job, you lose your employment. You have now to worry about, what will I do? Pay my rent, buy food, and all those serious issues. Food insecurity became a serious problem. And as a matter of fact, the African American Health Program decided, let's see what the people that we've been touching for a number of years, how are they faring during the COVID-19? So we very quickly launched during a period of about 5 weeks or so in the early lockdown period, set about to call over 2,000 people that have been in contact with us. And how do they get in contact with? When we're in the community doing screenings and what have you, we get some basic demographic information, some contact information. If the contact is good, we will talk to you. We want to know how you're doing during COVID-19. How do you have, are you prepared to deal with it? I mean, all the anxiety that this pandemic has brought upon us, are you prepared to deal with it? What level of preparation? What underlying conditions do you have? Do you have hypertension? Do you have diabetes? Do you have cardiovascular disease, any lung diseases? And how would that elevate your risk for getting it or for dying of it? And so we actually, out of the 2,000 or so calls that we made, we were able to reach about 1,000 of them, 1,032 to be exact. And among those, some, of course, did not want to participate for various reasons. And maybe there were some of the lucky ones still working, so the time we're calling was not convenient. And it whittled down to about 427 people that we spoke with. And I mean, it's incredible what people share with us. We found ourselves being the consolers, educating them on the prevention medicine, ensuring that they were getting good information about COVID-19, asking them whether they have sufficient food, whether they have at least 2 good weeks of food at home. Remember, it seems like a very, very long time ago, where we were not supposed to get out of our houses. And so we needed to find out whether our people have enough food. And when they didn't, we could identify some food resources to bring those food to them. And in some cases, we got out. Some of our staff took some food and took those to those people's home and left it at the door. And when the time came for grab and goes, for food distribution, we jumped right into it in sending staff. I don't know where I am with I told you, I would usually just leave the PowerPoint presentation and just talk and talk and talk. And that's where we are right now. So we started doing the teaming up with various entities, churches, civic organizations to, if you see in those drive-by, if you see some people with a red shirt, give them say hi to them. Those are the African American Health Program, bringing food, helping with the packaging, helping with the distribution, and also providing health information and telling them that we are still in business. We switched from the physical, the one-on-one, the in-person interventions to a virtual. And we did that, almost immediately before other people could jump in. So we were into Zoom, we're into Teams. We have classes that are offered on Tuesdays. You can get something. You can get on Monday, even on Mondays, you can get yoga. You can get exercise. You can get the nutrition is definitely part of what we do. So the Tuesdays from 11 to 12, we have the health and fitness class. We have to address the mental health needs of those populations. That's one of the areas of need in that area. We have on staff one social worker. We literally work her to death because she had to respond to the needs of people from across the different programs, particularly those pregnant women. Those pregnant women, they have to continue to nurture, to continue to manage, and to continue to take care of their baby. They need good food. They need the mental health. They need, some of them just did not have enough time to get on the insurance rolls. We help them through all of these. And talking about nutrition, I mentioned our Food for Life instructor. She continued to do food demonstration virtually and to share the recipes to our audience. We also have another nutritionist who's been doing gardening and nutrition on Thursdays from 6 p.m. to 7:15. This is how we continue. I mentioned earlier, cancer is important. The nutrition is an important part of cancer. So we have I've already spoke about the stressors of COVID-19. Need not to repeat them. You have loss of employment, having to educate the kids at home, food insecurity, top and foremost, housing insecurity, social injustice, and implicit bias that even during COVID-19 we have to deal with. So those are aspects of COVID-19 that the African American Health Program attempted to deal with during this difficult period for all of us. Believe it or not, HIV, STI, still in our midst. So what do? We have to find ways of getting people screened or to tell them if they can to practice safe sex. And the instructions continue. We recently, in August, we pushed the envelope. We started doing actual screenings, going to Progress Place, going to the men's shelters to test people for HIV. And we're not just doing the HIV, we're still doing the other screening as well, screening for hypertension, high cholesterol, for diabetes, of course, and mental health, encouraging people to go to our website to take advantage of the many tools that we have available to the public. Right now, if anyone, once a month, we go to the men's shelter on Taft Court in Rockville, as well as the Progress Place on Georgia Avenue to do those screenings. And thanks to the collaboration that we have with Manna Food, we're able to get some food also and bring to them. We already spoke about mental health. And of course, when you eat, you have to keep your mouth clean. So our focus area of oral health, we have on staff, we have as a consultant, a very prominent and culturally competent dentist that is still participating in those virtual classes that we offer. So even some of the intervention that we had nothing to do with our mission, but we believe that we have to participate in what is happening in our environment. So Black Lives Matters, when they start protesting, we provided water with our logo on it and neck tags. So it's not surprising that the work that we're doing was recognized by the Maryland Public Health Association as the SMILE program as being the best public health project in Maryland in 2018. And also around the same time, we were recognized by the Maryland Black Caucus for Community Service Award. And so I'm gonna stop here, and I think I've been able to tell you about that disparities didn't go away when we went to virtual world. Disparity is still real. It is not virtual. Hope I was able to just give you a flair, a little bit of what we do. There is much more to what we do at the African American Health Program. And also to tell you that during COVID, we were present, we were in the community, and we were focusing on what is so dear to your mission of food, ensuring that food insecurity does not add to another layer of complication and problem to people. And I think I'm within my time, and I will stop here. If there are any questions, I will entertain those.
Black tummy tea, waist trainers, or bundles. That's all they're out here spending money on. I know I'm guilty. I used to think that I'm like, listen, your girl's about to start a black tummy tea collection just to get paid on IG, even though I ain't got a black tummy. Okay, I thought I was gonna have to do that.
Somebody might need to mute.
Linda, Soraya.
Awesome. Thank you so much, Dr. Dambita. I wanted to know, does anybody have any questions or thoughts after listening to Dr. Dambita's presentation?
Here's what happens when you believe that. You treat your Instagram, and by the way, anytime I say Instagram, you guys, it is relevant for every social media platform. So when I say Instagram,
And if everybody can make sure that they're muted.
We're still hearing somebody.
Yeah, thank you.
Yep.
Any questions or thoughts?
George McFarland here. I'd just like to add a couple of thoughts. First of all, I want to thank you, Cynthia, for inviting us to be a part of this important event. And I think it's really remarkable how my wife, me and my wife meeting with you shortly after the opening of the new center on Tech Road just opened my eyes for so many things that we could do together. And I'm pleased to say that at this very moment, part of our staff are down at the People's Community Church, Baptist Church, distributing food for the grab and go there. And that's extremely important. Dr. Dambita talked a little bit about the work that we are able to do through the support and assistance of Manna Food, that we couldn't engage with people the way we do if we didn't get the kind of assistance that we're getting from you. So people who may perhaps would not be coming in to be tested for HIV or cholesterol or blood pressure, A1C, would not be there if we didn't have the food that we're able to say we're able to offer them food as sort of incentive to take care of their health. And I think Dr. Dambita's message that food is medicine, and not only is it medicine, but it is one of the best types of medicine. Dr. Andrew Weil wrote a book some time ago about some of the negative consequences of prescription drugs because of the fact that they are compounded, and sometimes that our bodies are not able to tolerate the concentration of features that are built into some of the prescription drugs, but food as a source of medicine can be very effective. And so we just want to say we appreciate the opportunity to join with you, and we need this for that engagement. Particularly, I'm going to say that one of my disappointments has been that at these grab and goes, Black people represent a relatively small proportion of people who are lining up in these cars that sometimes extend for 2 and 3 miles. I don't know what we got to do, we have to do to alert them that this is a chance to live healthier and longer by improving your health. And if you want to improve your health, one of the best things you can do is start with your nutrition. That's something that policies, when you talk about Black Lives Matter, you got to start with that life that you have. And that's really important. The other things are important, but they may not be within your immediate control. But if you start with you, with the change that you seek, I think that's really critical.
Yeah, awesome. And I think that actually is a wonderful bridge. And I appreciate you, Mr. McFarland, because I think it's a perfect bridge to a great discussion question.
I see that Reverend Rebecca is asking for the areas of greatest disparity in Montgomery County. I can read them off. And by the way, I will make this PowerPoint presentation available to you if you want to distribute to those people that are not here present. You have 20886, that's Montgomery Village. There is 20912, Tacoma Park. Rockville, 20850 and 20853. There is zip code 20874 and 20876. Both of those are in Germantown. In Gaithersburg, 20877, 20879, 20982, and 20899. Silver Spring, three of them, 20901, 20906, and 20910.
Thank you. It seems like Cynthia had some technical problems and she'll probably be getting back on shortly. There's another question in the chat about the availability of chronic disease management programs. Are they currently available on Zoom?
Yes, we have them on Zoom weekly. There are 4 sessions. There is one on Tuesday afternoon. There is one on Wednesday evening. There are 2 of them on Thursday, one in the afternoon and one at 6:30 in the evening. The way we did it is that we no longer bound by geography and we no longer bound by time, because that's the way we were operating before. Remember, if you lived in the White Oak area, Wednesday evening, that's the only time of the week, and that you can, we can get together with you. If you are in the Germantown area, Germantown Library, those were also in the evening on Thursdays. And then we initiated a new program also with Leisure World on Thursday afternoon, and another one we're just getting started at Plum Guard, and all those things were stopped by COVID-19. But what we did, we are now offering a variety of programming all week long. So anyone can sign up of any of those presentations. You can you can have the opportunity to hear about cancer if that you're interested in during the week. You can hear about diabetes. You can hear about cardiovascular disease, how to control hypertension. You can, if you just want to know how to reduce stress, then you can participate in the fitness classes or the yoga classes. Or if you want to try out some the plant-based food instructions that we give, and that's also given weekly. So every month we generate a schedule that goes out to the public. Go to our website, you will find a schedule every month, and join us. You have to pre-register for this class. Once you pre-registered, and it's good. Your registration renews automatically every month. And I have the nurse who's in helping coordinating those classes, Carrie Fonge, who's on the line. And if you want more information, you can contact her, call our main office. There's always, any time of the day, you will have someone will pick up the phone or get you a message, and we'll get back with you.
Also, I was just wondering, Barry, if I think I see you on the line, if you could put this current September schedule in the chat box, that way everybody can, if you can just paste it into the chat box, everybody will have the schedule. Also, I wanted to mention that we now have a weight management coach, and you could reach her at 301-233-9612. Her name is Regina Barnes, and we are trying to increase the number of participants who are enrolled, particularly in the weight management program. Also, Dr. Akina Myers has office hours. I don't remember the precise date and time. I think it's Tuesday through Thursday. If you want particular consultation, individualized consultation, he will be available to answer your questions around chronic disease management. In particular, he takes the lead in all of the chronic disease management classes that we operate.
Awesome. Bernice had a wonderful question, and Angie, I apologize, my internet went out, so I don't have the chat part.
Sure. The question is, what is being done to ensure that Blacks will get priority to the vaccine for COVID-19 once it is available?
Well, it's a very good question, and it's pertinent to our population. We would like to see a greater participation of the Black people with the testing right now. What we have right now is testing, offering testing to the people. And testing is important as an important tool. Until we have a vaccine that is safe and effective, we have to do the here and now things. It's maintaining, doing the hand washing thing, disinfecting surfaces, keeping social distance, and wearing a face mask. Those are important things that we need to get all the Black people to do right now, because if you break the transmission cycle, then you ensure that you will stay, you will protect yourself. Now, to answer the question, all we can do is to push the policymakers, and those are deciding. We will not, the county, the governor will decide, will prepare for this, if we get an effective vaccine, for vaccinating the population. And what our role as the African American Health Program, once we know that we have an effective vaccine, a safe vaccine, is to educate Black people that it's very important for them to grab the opportunity to be vaccinated. This is further down the line. It may be, if you get a vaccine, it may be later on. It's possible, it's unlikely that we'll get it before the end of the year. And once we have it, there is a whole logistics of distribution. And what I can ask all of us to do right now is to go and be vaccinated for the flu, because you don't want a double whammy of COVID-19 and the flu. That would be my advice.
I would also say that, as you all know, it's the issue of trust is really huge among Black people in particular, because of the scientific community has so often abused the relationship with Black populations, particularly with respect to research. So we have a huge challenge in front of us of trying to turn that around. Traditionally, nationally, less than half of all Black people in the United States are vaccinated for the flu. And a lot of that has to do with mistrust that we didn't create, but we have to find ways to build trust. And I think that comes from the kind of things that Manna Food is doing with its food, that's saying, I'm your friend. I want you to live healthier and longer. I don't think it would be mandated by public policy. I think it took a long time. Tuskegee still rings very loudly in the ears of Black folks, and I still hear people who I know, who are even educated people, who say, I'm not sure I'm gonna be vaccinated once the vaccination is available. I think that takes time, it takes patience. It's like building trust and love and relationships. We don't have enough Black people who are involved in research. We don't have enough Black clinicians who look like the people they serve. And as long as we don't have as many Black people who look like the people being served, I think there's going to always be a certain level of distrust. And it's not a panacea to simply mandate it. It comes from building relationships, and relationships that are empathetic and show compassion and care.
That's great. That's great. And I totally agree. I'm interested to know if anybody has any thoughts or ideas that revolve around what we could be doing, even if you're not a part of AAHP, you're not a part of Manna, but operating more as either a small collective or as individuals. How can we better serve our Black and Brown communities, more specifically, because today we're talking about African American, African, and Caribbean communities? What are those things that we could be doing to not only push these resources out, but also build that trust that Mr. McFarland is talking about? And just off the top of my head, there are so many of these groups, and one of the reasons I really love AAHP is because they are a group that's involved in their community and involved in the community that they serve, which I think is so important to be able to share resources. That's why we partner with groups like this, because, you know, sometimes as a large organization, it's a little bit harder to kind of gain that trust from people. But when you hear it from your neighbor or your friend, it's a little bit simpler to go, oh, I've heard of this great group and they are doing X, Y, and Z, and I trust them, so you should trust them too. On top of that, does anybody else have any thoughts or feelings around building trust and how to do that as an individual or a small collective group?
I don't want to talk too much, pardon me if I do, but I think one of the things that I'd like to say is I talked a little bit about the engagement, and an engagement is where not only do we give, but we also expect. It's a reciprocal relationship. One of the things I'm trying to push to the people we serve is that we also need you to come with us to county council hearings and meetings. Too often I go to meetings at the county council building, and there are 5 Black folks there. There are a lot of people of other ethnicities there, and the room is packed. And the message that sends is that the people we are trying to serve don't care. Perhaps that's not the message intended, and maybe it's a much more complex mission. So what I'm saying is, when we're trying to reach out to you and help you, we also need your help. So when they're talking about later this month, the county council is going to have a proposed budget for 2022. There are going to be some town hall meetings. Many of these meetings are going to be virtual now. We need people who are Black and brown to be on those Zoom calls and to ask questions about, and to say that when I was hungry, Manna food fed me. When I was sick, AAHP came to my aid. When I was pregnant, AAHP called me. The first call I got after COVID-19 was from AAHP. Okay, that's what we need. We have to stop just doing for people, but we also they have to understand we also need something from you. And this relationship needs to be fed by both of us.
Thank you, Mr. McFarland. Yeah, definitely. It's a holistic perspective. We can't just talk about it, but we have to be about it. It is that whole notion that we need to be about advocacy. We need to show up. We need to make ourselves available. I realize it is 1:15. Angie, did you want to switch over? And I think both Dr. Dambita, George, Barry, thank you guys for coming and attending. And your perspectives are so valuable and needed in our community. So I thank you for attending.
Thank you for inviting us.
Thank you.
And thank you, Dr. Dambita. Yeah.
Yeah, this has been really wonderful, and I appreciate all of the sharing that we have heard. We typically end our sessions with an invitation to action and asking you what you feel inspired to do. So our final question is, what are you willing to do over the next 30 days to explore the root causes of hunger and food insecurity or poverty? And what are you willing to commit to exploring over the next 30 days before we gather together again? So I'll just open up the floor to anyone who might be willing to share something that you might have heard today that has inspired you to do some research or to commit to doing something new. So we'll just see if anybody has anything to share. And you're also welcome to share any final thoughts that you haven't shared already.
I think one of the things that I have been inspired to do after Mr. McFarland was speaking is making sure that my voice and my face is seen in these important meetings, and making sure I'm a better advocate. Not that I'm just not doing the work, but also, so I will be looking for meetings to attend. And George, if you have any that you hear of, please send them my way, because I'm really interested in that now.
I agree, Cynthia. I know that Manna usually does have representation at these meetings, but it is a call to share the information as broadly as possible so that we can encourage more supporters to show up. And I know it is often challenging for us to find folks who are willing to do that, but the sooner we start, we may be able to get some more interest from people who are working with us to be present.
Hi, this is Cheryl, and I hate to ask like a kind of probably a dumb question. I just don't know the answer. Is there an African American health project in like every city? So I'm in Philadelphia, and is there that organization here in Philadelphia?
I'm not aware of program in Philadelphia. I think one of the things I'd like to see happen is when you look at the health disparities throughout the United States, and every county, the problem is the same, it's just bigger. And the disparities anywhere down south are greater than they are in Montgomery County, as Dr. Dambita said. In fact, in some ways, Montgomery County, when you look at the racial disparities in health, they look relatively good compared to, say, Baltimore, but that's not sufficient. And I think that, like religion, if we can be a bright light that shines in Montgomery County and let that light shine brighter throughout the nation, it's how so many of our organizations got started and grew, like AARP and other organizations that started with a seed, planted that seed, and it grew nationally and promulgated to counties and states. And I think that's what people are seeking, a definition of what does Black Lives Matter beyond the next 6 months? Will it dissipate? How can we make it take on a life that continues to grow and thrive like plants do? And that's what I think is a real challenge for all of us. Will it become something that we see in the rearview mirror in 6 months and say, that's right, we did this in the 60s, and then we did it again in 2020. Will we say that again in 2040? That's on us. We have to give the answer to that question.
And I'll add to that this is a question on the minds of many people. We had a meeting not too long ago with the Lions. This week, we had a meeting with the Lions Club, and they thought really, based on what we've been doing in the community, that we were a national organization, and making the point that there is a need for AHP across the nation. But the mere fact is that Montgomery County decided to invest in the reduction of disparities. And the contract is for, we are limited, our scope of work is limited to Montgomery County, but it will be a good thing to see something like this blossom across the nation, because the need is there, and the needs might be even greater in other communities than it is in Montgomery County.
I see a couple of comments in the chat about the conversation around trust. And I know that this is a big issue related to what Mr. McFarland was speaking about. Are there efforts to try to build this trust? I know that the work you do at AAHP helps the Black community to have a trusted place for healthcare. Is there a way to address this going beyond the healthcare provided directly to the Black community so that there is greater trust in the broader health community?
I think one of the things I would challenge us to do, meaning when I say us, I mean the people who are on this call, on this Zoom call today, is we ought to put together a proposal that's submitted to some foundation or some federal agencies that addresses the issue of building trust through food and social interaction. Right now, I'm just thinking aloud, so I'm not pretending that I have the answer, but I think if we start a dialogue, that we do an outline of what this could look like. I know when I came over to the Manna Food office there on off of Tech Road, Old Columbia Pike, and I saw that you had a little conference room and that you had, you know, I know we're observing social distancing, but why couldn't we do some video demonstration, food demonstrations, and invite people to do some virtual food preparation, you know, in some kind of way that we kind of have a little social gathering. You know, it could be just a dessert or, you know, I know Mrs. Robiner, who does the food demonstrations for us, she does them from her kitchen, but we are broadcasting those on Zoom. And so, and let there be a discussion like right now, just like we're having, you know, what does it take to build trust? Why don't you trust me? I think we are so similar, but we focus on our differences, not on our similarities. You know, when you peel the skin back, we all look the same. But some kind of way, we get things twisted. And it's not a take an aspirin and call me tomorrow and tell me how you do. It comes from frequency of communication, open and honest communication. And that's hard to get to because there's a lot of trauma, there's a lot of hurt, and there's a sense of vulnerability that we have to get to it. And so I think that if this past Saturday, I was on a call with people who were talking about the black folks' participation in clinical trials. And every major clinical trial, including the 5 clinical trials now that are being done with the vaccination within the 3rd trial, have a huge underrepresentation of Black people in those trials because of lack of trust. We can build trust, but I think maybe it's groups like us and growing these groups that talk about why you don't trust and how could we build trust. I think that could be very helpful. And we could write that up as a proposal. We perhaps could write it up as a joint proposal that's funded by the USDA and NIH. NIH has a huge problem. They have an office just designed about trying to build participation in clinical trials.
So my commitment will be to make sure that we do have that conversation and see where we can go with this idea. You know, as I've been thinking about COVID and the needs of the communities that are disproportionately impacted, when I think about the Black community, I think about these long-term needs, you know, long-term solutions to making a change. And I think that this is a key part of it. So I look forward to us having more conversation around that. We are getting close to the end of our time. Is there anybody else who would like to share a commitment for something that you would like to do over the next 30 days?
Sure. One thing that I plan to do based on this conversation is to be mindful again about where people can shop, what shopping options are open to them for food. This is something I used to think about decades ago all the time, and I think that life has just gotten too busy and I've gotten distracted. And this conversation has really made me realize that I need to keep thinking about that. As I drive all around Montgomery County, which I do all the time, all different parts of Montgomery County, I should be, as I'm doing that, I should be thinking, where do people buy food here? Who is buying food at these various places? What type of quality of food are these places offering? And like I said, it's something I used to think about a lot and be very concerned about. And I think it's time to revisit that as I just go around the county. So thank you for re-alerting me to that issue.
Thank you. Who else has a commitment that they would like to share?
I would like to make a comment. Someone asked about if they could invite more people to get people into these classes. I have shared the link with Ms. Cynthia through email. My commitment is to reach out to as many people as I can, you know, so that they could be aware of this information. And there are lots of other resources that we do connect them to in the county if we cannot provide services for them. Thank you.
Thank you. All right. Well, I want to thank everybody for joining us today for this important conversation. I definitely want to thank our guest speaker, Dr. Dambita. We really appreciate you sharing your time and your wisdom with us, and to Cynthia for facilitating this conversation today. We gather together for Breaking Bread every month on the third Wednesday, and third Wednesday of the month at noon currently. And the next one will be on October 21st. So we hope that you will come back and join us again and bring somebody with you. We have one more commitment in the chat. Reverend Dr. Rebecca Savage says she commits to sharing about AAHP with her Black congregants. And what an amazing resource. And we agree. Thank you, Mr. McFarland, for everything that you shared today, and everybody who shared something. We really appreciate it. This is an important conversation. So we look forward to seeing you next time.
Thank you much.
Take care.
Thank you.
Thank you.
Yeah.